Natural remedies for gout. Natural gout treatments. Among the home treatments for gout are 1. Eating lots of water. Gout sufferers may notice considerable edema and inflammation in their body. Increasing water consumption is one strategy for symptom reduction. Increasing fluid intake might cause the kidneys to excrete more fluid, which will lessen gout sufferers' swelling. Best is water. Still, other clear beverages like herbal teas and broths are also excellent options. Because they contain a lot of purines, soda, and alcohol should be avoided. However, before increasing their fluid consumption, people with kidney illness or congestive heart failure should consult their doctor. 2. Using ice on affected joints. Gout-related inflammation can be reduced by applying a cloth-covered ice pack to the joint. To help reduce discomfort, wrap an ice pack or other cold object in a thin towel for 20 minutes. 3. Stress reduction. Gout symptoms might be exacerbated by stress. While it is not always possible to remove all sources of stress, the following self-care recommendations may be beneficial. Exercising if the discomfort does not restrict movement, requesting time off from work, journaling or reading a favorite book, and meditating. Getting enough sleep might also assist a person in feeling less anxious. 4. Raise the afflicted joints. Gout can cause swelling and pain, particularly in the feet, hands, knees, and ankles. Elevating the afflicted joints is one method of reducing edema. This forces blood and fluid away from the joint and toward the heart. An ice pack with elevation can also be used to alleviate gout symptoms. These two therapies are part of the RICE approach: rest, ice, compression, and elevation. 5. Using over-the-counter analgesics. While over-the-counter OTC anti-inflammatory drugs like ibuprofen, Advil, and naproxen sodium, Aleve, are not natural, they are effective in treating gout pain and inflammation. People should never exceed the authorized dose and should always consult a doctor if OTC medications may interfere with their other medications. If over-the-counter pain remedies do not work, a person should consult a doctor regarding stronger prescription. 6. Coffee consumption. Some people believe that drinking coffee reduces the risk of getting gout. According to a 2016 review and meta-analysis, people who drank more coffee were less likely to have gout. This could be because coffee lowers uric acid levels. A subsequent 2022 study found that coffee consumption reduces gout risk without lowering serum uric acid levels. However, just because the study found a link between higher coffee consumption and a lower risk of gout does not mean that coffee caused the lower risk. 7. Consuming a well-balanced diet. A well-balanced diet, rich in nutrient-dense, minimally processed foods, can help lower uric acid levels and reduce the risk of gout flares. Gout sufferers may benefit from a low-fat, low-carbohydrate, plant-based diet. Many fruits and vegetables are high in antioxidants, which can aid in the reduction of inflammation. 8. Consuming lemon water. A 2015 study discovered that drinking 2 liters of water with the juice of 2 freshly squeezed lemons each day reduced uric acid in people with gout. The researchers concluded that drinking lemon water helps to neutralize uric acid in the body, thereby lowering levels. 9. Limiting alcohol consumption. According to a 2021 study, heavy or frequent drinking may increase a person's risk of gout. Beer contains a lot of purines, so avoiding it can help with gout. 10. Avoiding meats high in purine. Purines are abundant in certain meats. Avoiding these may help to alleviate gout symptoms. Purine-rich meats and fish include bacon, turkey, veal, venison, organ meats such as liver, anchovies, sardines, mussels, herring, cod, haddock, auk, trout, scallops. Medications. Doctors may prescribe medications to treat severe gout flares. These are some examples. Non-steroidal anti-inflammatory drugs, NSAIDs like aspirin and ibuprofen, can help with gout pain and inflammation. Colchicine, this medication prevents uric acid crystals from forming. Colchicine can be used to treat existing gout symptoms as well as to prevent future flares. Corticosteroids, in cases where other medications have not relieved gout symptoms, doctors may prescribe oral or intravenous corticosteroids. These medications have the ability to reduce inflammation and pain. Other therapies. In severe cases of gout, doctors may recommend surgery. If gout causes severe pain, a major abnormality, or a severe infection at the site, a person may be a candidate for surgery. Gout surgery options include joint fusion. If chronic gout causes extensive tissue damage, surgeons may fuse two joints together to stabilize them. Joint replacement surgeons can replace damaged joints with artificial structures. Tophi removal. In cases of severe discomfort, abnormality, or infection, a surgeon can remove tophi. Bottom line, gout flares can be excruciatingly painful and exhausting. Treatments, including home remedies, can alleviate symptoms and help prevent flare-ups in the future. Maintaining a healthy weight and exercising on a regular basis can also help a person manage their condition. If a flare does not subside within 48 hours, a person should contact their doctor to see if they require additional medical treatment.